Holly Crawford, Director of the County of San Diego Office of Emergency Services. My job can range from planning and preparing for natural and man-made disasters to alerting people when disaster strikes. So your role in helping provide safe shelter during man-made or natural disasters is critical. This video is the second of 3 training videos designed to show shelter workers how to employ best practices and procedures when caring for individuals who need additional assistance in a disaster shelter. It can be an extremely stressful situation. This stress is compounded for those with cognitive disabilities. For someone with a cognitive disability, day-to-day routine is important to maintain their emotional well-being. As a shelter resident, that routine is disrupted, and this video will provide you with techniques to manage situations and anticipate needs. This training will assist you in handling a variety of situations and make everyone's experience as positive as possible.
The County of San Diego Office of Emergency Services works with employees from the 18 cities within San Diego County, along with several local agencies, to provide shelter when needed. The American Red Cross is one of the lead agencies. The American Red Cross's mission is to prevent and alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. Each year, the Red Cross responds to nearly 70,000 natural and man-made disasters in the U.S., ranging from fires to hurricanes, floods, earthquakes, tornadoes, hazardous material spills, transportation accidents, and explosions. They provide food and shelter in emergencies, assist members of our armed forces and their families, as well as teach life-saving skills, and more. Volunteers are at the heart of the American Red Cross and a huge part of its success. People from local communities are relied upon to help carry out humanitarian work. Local volunteers make up 95% of the workforce that makes it possible for the Red Cross to respond to disasters and save lives.
In an emergency, there's no way to predict who will arrive at a shelter, the precise nature of their needs, or the challenges the shelter staff may face. This training video is meant to raise awareness and address some of the needs and considerations important to assisting shelter residents with cognitive disabilities. It's a starting point.
A disaster has occurred. Shelters are opening to assist people who have suddenly become displaced. Your job is to greet them, to welcome them, and as quickly as possible make them feel comfortable. You must assess their needs and direct them to the appropriate people and services at the shelter or outside the shelter if necessary. People with cognitive or intellectual disabilities may struggle more than the average person with one or more types of mental tasks. They may have difficulty multitasking, following instructions, effectively communicating with others, or solving problems. When they encounter unfamiliar surroundings, such as a disaster shelter, their confusion and fear may be intensified. They may not feel safe, and you may need to reassure them frequently. The degree of discomfort and difficulty can be very mild or quite profound, simple or very complex, obvious or subtle. The cause of the cognitive disability itself may stem from a variety of causes, from hereditary to disease to accident. Every age group can be affected. People with cognitive disabilities may also have other disabilities. The modules you will learn in this video that are specific to people with cognitive disabilities are categories, causes, and consequences, registration and intake, how to help someone with developmental and intellectual disabilities, how to assess and approach people with autism and autism spectrum disorder, memory loss, dementia, and Alzheimer's disease, and other considerations regarding cognitive disabilities. The concept of cognitive disability is broad because it addresses many areas of activity of the brain. There are 4 basic categories of cognitive disabilities. Intellectual, that is significantly impaired cognitive function, which formerly might have been labeled mental retardation or the result of developmental deficits. Specific learning disabilities such as dyslexia, in which the person has difficulty acquiring information in a typical manner. Acquired brain injuries, which are the result of damage that occurs after birth. And neurodegenerative disease is generally characterized by progressive loss of cognitive function, such as Alzheimer's, Parkinson's, Huntington's, or even age-related dementia. Cognitive disabilities manifest themselves in many ways, from forgetfulness to loss of memory. The disability might be noticeable when the shelter resident demonstrates difficulty paying attention or understanding information presented verbally, visually, or in writing. Erratic, inappropriate, or unusual moods or behaviors, and trouble communicating with others. These are things a shelter worker can keep in mind while interacting with shelter residents. It all begins with respect and equality. Treat those you help as you would want to be treated. Every newcomer to a shelter must be registered. This is critical for many reasons. Shelter workers need to know who people are. They need to know how many people are in the shelter to make sure there are adequate supplies and meals. Registration is a good opportunity for shelter workers to evaluate incoming residents. There's an English and Spanish registration form. Our community is diverse, and some shelter residents may not speak English. You may need to look for someone who is bilingual to assist you in a language you don't speak. It's important for the evacuee to understand your questions. If a translator is unavailable on site, you may request one through the shelter manager, who will contact the Care and Shelter Branch Coordinator from the Emergency Operations Center. Remember, there may be a slight delay in the arrival of the translator. Make every effort to communicate with everyone. Don't assume that people understand when they nod in response. Confirm their understanding before continuing with questioning or providing information to shelter registrants. The first step is to make your initial observation of the evacuee using the registration intake form. The questions on this form will help you to identify their needs and obtain the needed services and supplies. If someone needs help to fill out the form, make sure to ask them if they have a caregiver or family member who can assist them.
Is there anyone here that can help you with the registration form? Is there? Okay. I'm gonna call for help and see if we can complete this form together, okay? Can I get a manager's assistance here at registration? Great. Hi, I was explaining to him that I need to complete the registration form for him for his stay at the shelter.
Okay,
So,
absolutely.
So first name, your first name?
Is Debbie
Debbie, okay. And your last name, Debbie?
Peterson?
Peter, what is your relation to each other?
Brother, sister?
Brother, sister, great. Epperson? Okay, great.
It's okay. You're going to be fine.
How
You're here and
many?
you're safe.
How many in your family are
There's
here?
just the two of us.
Just the two. Okay.
If they don't have a caregiver, you may need to help them fill out the form, or you may need to fill out the form for them, depending on the level of need. Keep in mind that just because a person has a disability, it doesn't mean they need medical attention. Through your observations, you'll need to determine if the evacuee or a family member appears to be in need of immediate medical attention, appears too overwhelmed or agitated to complete registration, or pose a threat to themselves or others. If it's not apparent, or if assistance is required, politely ask. If the answer is yes, stop the registration process. At this observation, the first thing to do is to notify a shelter manager and possibly a medical services or mental health worker on site.
How
How can I help you?
I don't know why I'm here. I had to leave Max, and Max needs his medicine, and I
But
forgot.
Linda, there was a disaster. There was a disaster. Is Max your dog?
He's Max, and he needs his medicine, and I'm not supposed to touch tinfoil. And I left the tinfoil out.
How about if I get you some
gonna
help?
touch the tinfoil.
Let me call my manager. Let's get some help from Max. Okay, it's okay. I'm here to help you. Okay.
Who?
Hi, Jamie. Can you come over
gonna
here,
talk
please?
about me? Don't talk about me.
I'm not. We're coming
Don't
here to
talk
help
about
you.
me.
I
Why?
understand it's a little scary.
They're all talking about me. Why
Linda.
do people always talk about me?
Linda, it's okay.
Shelter managers will have a lot that they're handling, and you can help them by properly evaluating and prioritizing issues of concern before you contact them. If the situation is critical and/or the situation requires support that is not available, call 911. This is only for life-threatening conditions, and the shelter manager must be notified, preferably before you call 911. When that is not possible, make sure you notify the shelter manager immediately after making the call. If the evacuee appears, demonstrates, or tells you they need additional help in the shelter, acknowledge their need and offer assistance. This may include contacting a medical services worker. Every person is different. Your training manual contains a more comprehensive look at the registration process and how you, as a shelter worker, can best do your job in these first moments. Ask the medical services staff or shelter manager if you are unsure about your assessment. Every person registered deserves your proactive, respectful consideration. You're there to help and anticipate needs. Assisting a person with cognitive disabilities often requires an even greater astuteness and sensitivity. For example, if you know or believe the person has a cognitive disability, you may want to introduce yourself more gently and comprehensively.
My name's Teresa. I'm one of the shelter workers. What's your name?
Beth.
Beth, it's nice to meet you.
Show your badge or ID card while you identify yourself and explain what you do. Use plain language, short sentences with simple, concrete words, and specific intentions and directions work best. Use pictures or objects to help illustrate your meaning if possible and necessary. Point to places, people, or objects when you talk about them. If you need to direct a resident to another area in the shelter and they're reluctant to go alone, accompany them or find someone who can go with them. Point out shelter staff who can help with their needs while they're at the shelter. Speak calmly and competently. Try to minimize any surrounding distractions. Be patient. Give the person time to process and respond to what you're saying. Smile gently. Offer a chair or a hand if they look tired, or say they're tired. Explain as best you can what will happen next, whether it's the scheduled lunch or a briefing by officials. Be accurate and honest. Don't predict what you don't know, but do project a sense of order, progress, and compassion. Reassure them that everybody is working hard to return things to normal. If at any time the situation exceeds your level of training and comfort, seek assistance from the shelter manager or medical services staff at the shelter.
People with disabilities are just like everyone else. They just might have a significant disability that doesn't preclude them from wanting and needing the same types of supports that everyone else needs. If an individual with a disability comes to a shelter in an emergency situation, it would be best for the shelter worker to initially ask the individual, how can we best support you? Are there any special needs that you have? Do you need assistance with reminders? Do you take medications that you need us to remind you to take? If so, what times? If the individual is overwhelmed, which I'm sure going to a shelter would, cause someone to be a little distressed, you can just possibly send them to a nice quiet area to calm down. Reassurance is really helpful, to constantly reassure that this is just temporary. We will try to find your family or significant others, whatever the case may be. Just to keep people calm and to let them know that everything's going to be okay, and repeat that. treat people with respect and ask them questions and do not assume incompetence would be really helpful, because most people with disabilities are very capable individuals and they know best what's good for them.
I have epilepsy. I was born having had a stroke at age 5, so I've dealt with a lot of challenges every day. I feel better at a shelter if somebody reassured me that things were gonna be okay, and if anything needed to be explained to me, that they explain it twice so I could understand it better. Start asking questions and see how the person responds, if they can speak or not, and then find other ways of trying to communicate with them. I would prefer to be treated the same as everybody else, but at the same time for them to know that I have epilepsy and to know that I have some limitations, but don't treat me like I can't do anything.
Intellectual disabilities can be characterized by significant needs in daily functioning and in social and self-care skills. Oftentimes, people with intellectual or developmental disabilities struggle to communicate effectively and may require additional assistance in a disaster shelter.
Because I'm special needs, because I like to do things about dancing, about going to work, and I like to do the special things because my life is completely awesome. People treat me like differently, you know what I'm talking about? And they like to, and then to show you how, and when you like to work with them, and they can treat you better, like treat you nicely, and you know, and then to treat you with respect, and then to treat me with respect. So it is good to go, yeah.
The following are examples of additional support that may be needed. Assistance with completing the registration form. Easy to understand information about the shelter, sometimes given more than once. A tour of the shelter and an explanation of the services there, again, sometimes more than once. Someone to calm fears about the shelter and the new environment. A quiet and calm area. Assistance with replacement medications when necessary. Someone to show them where the medical treatment they need is located. People with intellectual or developmental disabilities may demonstrate behaviors that you should be aware of as a shelter worker. They may not understand social norms, and they may invade your space or prefer to be farther away from you than you'd expect. They may also avoid eye contact. The person may look at you at an odd angle, laugh or giggle, or appear to take the situation lightly. Remember, these behaviors are not intended to be disrespectful. People with cognitive disabilities may display behaviors that are misinterpreted as drug abuse or psychosis, defiance, or belligerence. However, when you speak with them, you'll know this is probably not the case. Generally, it will take more time for the person to communicate their thoughts. Remember to be patient. There are different levels of intellectual and developmental disabilities. Talking with someone with a mild form is very different than talking with someone with a moderate or severe form.
I have an audio process disorder. It's where I can't understand a person. I can't understand the person when they're talking too fast or too much information at once at me. Then I can't really understand what they're trying to say and what they want me to do or what direction they want me to go in. So you have to talk to me like right to the point and directly. I'm special needs, but I can understand a lot. I just know I have a disability. Sometimes I don't understand my disability myself. So I would want them to treat me like everything's calm, nothing's wrong, with respect instead of like a normal person or something that they would meet off the streets. Like that if I didn't have a disability, I would want them to treat me like I didn't even have a disability, or just like a normal person.
Sometimes a person may understand much more than they can communicate. Conversely, the person's expressive speech may sometimes give an impression of better comprehension than they actually have. The person may repeat what you have said, repeat the same phrase over and over, or talk about topics unrelated to the situation. They may have a variable or limited ability to understand their own internal cues, like the need to urinate or feelings of anxiety. They may not be able to express their feelings and symptoms when you ask. If you're in a busy area with many distractions, consider moving to a quieter location to minimize distractions. If you suspect a shelter resident has an intellectual or developmental disability, ask them if they have family or friends who can help during their stay at the shelter. The best way to communicate with someone with an intellectual or developmental disability is to approach the person in a calm manner. Talk to them directly. Make eye contact. Try to build rapport and establish trust. Avoid touching the person, and if necessary, gesture or slowly guide them. Speak calmly. Use direct, concrete phrases with no more than 1 or 2-step instructions, or write simple instructions on a paper if the person can read. Make sure to allow additional time for the person to respond. Make sure the person understands what you're asking. You can do this by asking them to repeat the information back to you. If you don't understand what someone is saying, ask them to repeat it, or find another word or another way for them to communicate with you. Don't pretend to know what someone is asking or saying if you cannot understand them. Provide materials in plain language and keep things simple. If you are providing instructions, keep them short and one at a time. When necessary, clarify your expectations.
People out there who has open-hearted, don't be afraid, just being yourself. Treat me like an adult, but not. I am just going through some rough changes. Just be like normal about it.
Don't treat adults with disabilities as if they are children. Be mindful and respectful of their age. Always speak directly to the person, even if they have a caregiver with them. Do not speak directly to the caregiver, unless you have to because of communication challenges or because you are specifically addressing the caregiver.
Actually, basically, all about me is I have Down syndrome, and I am a student and a performer. Sometimes if people talk to my mother instead of me, I feel like, disappointed and feeling down.
If the person is showing obsessive or repetitive behaviors or is fixated on a topic or object, don't take the object away from them unless there's a risk to themselves or others. Sometimes simple distractions like offering them something to drink can stop the behavior. Avoid using phrases that have more than one meaning, such as knock it off or cut it out. When needed, use communication cards to better communicate. Communication cards provide clear options to both the shelter resident and the shelter worker. This may be the most effective communication for residents with difficulty speaking. Make sure the person stays away from potential hazards or dangers, since they may not have a fear of danger. Be alert to the possibility of outbursts or impulsive, unexplained behavior. If the behavior is not a threat to the shelter resident or others, wait until the behaviors subside. This may be an attempt to communicate and may not be intended to be disrespectful. Autism and autism spectrum disorder, or ASD, are general terms for a group of complex brain developmental disorders. Autism and ASD are characterized to varying degrees by difficulty in social interaction, verbal and nonverbal communication, and repetitive behaviors. Often there are associated physical disabilities as well, such as difficulties in motor coordination, sleep, and gastrointestinal disturbances. Here are some basic guidelines for assessing and approaching individuals with autism. Recognize that a person with autism may appear spacey or as if on drugs, fail to interact, respond to, or establish eye contact with you or others, touch strangers in socially inappropriate ways, not understand instructions or the presence of authority, have an extreme reaction to sound, touch, taste, or light, appear to be inexplicably angry or aggressive or in pain, cup hands over their ears as if hearing is painful, act unusually nervous, passive, or hyper, spin or wiggle an object repeatedly, seem to ignore you or seem to be deaf, react strongly and irrationally if a pattern is interrupted, have no speech, or are not understandable. Take a moment to be recognized and be patient. When you approach the individual, maintaining a distance will allow the person to complete their pattern of behavior, give the person an opportunity to respond to your presence, create a calm, quiet atmosphere to develop. Help with possible overstimulation or confusion. This includes loud sounds, excessive activity around the shelter, and bright lights. A person who has autism may wear a medical bracelet that indicates their condition. Autism is not a single disorder, and no two people with autism are alike. Like all of us, they're individuals, and they should be treated with politeness, respect, care, and consideration. Try to learn the person's preferred approaches and use them consistently. It's hard to know how a person with autism experiences the world, only that they may see, hear, taste, smell, and feel in ways different from people without the disorder, and ways that may be difficult for the rest of us to understand. It's part of your job as a shelter worker to recognize that and adapt. Forgetfulness is a natural product of aging. Eventually, it happens to everybody. Sometimes, though, age brings significant memory loss or dementia or progressive neurodegenerative disease like Alzheimer's. Alzheimer's affects more than 5 million Americans and, in turn, their family members and caregivers.
Hi, my name's Teresa, one of the shelter workers. What's your name?
My name's Beth.
Beth, hi.
What's your name?
My name's Teresa.
With a T.
With a T, absolutely. You seem a little nervous. Is there something that I can do for you? Would it be okay if I sit down?
You want to sit right here?
I want to sit right there if you'd let me.
Okay.
Is that okay?
Yeah, it's okay.
I can show you maybe where the bathroom's at. Do you have to go to the restroom?
Yes, I have to use the bathroom.
And then I'll show you around, okay?
Okay.
Come on with me. With me. There you go. I'm gonna make sure everything's okay.
There's a lot of people here.
I know, but you know what? You and I, we can do a lot of things together. We're gonna walk this.
Communicating with and assisting a person who has significant memory loss, dementia, or a neurodegenerative disease requires many of the skills and techniques already mentioned, and some others too. Try to hold conversations in quiet locations, with minimal noise and distraction. Gain the person's attention and maintain eye contact. Address the person directly, even if cognitive capacity is diminished. If the person is struggling to communicate, gently assist by providing a word or idea. If the person is elderly, consider the possibility that physical impairments, such as hearing or vision, may be adding to their confusion. Patiently orient them to the shelter, where they are and where they can find key services. Explain and re-explain if necessary what you're doing and how you can help. Confusion is to be expected. If a shelter resident gets the day, month, or year wrong, don't correct them unless it's important. Don't repeat information needlessly, but if asked, answer a question as often as necessary. Modeling works well. Walk a shelter resident through processes, including where and how to eat, dress, groom, and exercise. Instruction by example is often the quickest and easiest way to achieve the desired goal. Wandering and other repetitive behaviors are common in people with dementia. If the behavior is not a risk to the safety of the person or others, and it doesn't affect shelter operations, it's okay to let it be. If it becomes a problem, talking to the person might be sufficient to alter the behavior, or you might need to gently redirect the person to another location or activity. There are some things you should avoid doing when caring for persons with dementia. Avoid overstimulation, such as too much physical activity without a break or too much noise. These can overwhelm a person's ability to cope, which may make them more vulnerable to injury or less cooperative. Avoid saying no or you can't do that, unless it's a matter of safety. Sometimes a person with dementia has lost some of their capacity to reason and to accurately assess what's doable, practical, and wise. They may believe they are capable of things they aren't. Telling them no, or you can't do that, as you might with a child, is counterproductive. It's likely to provoke argumentative behavior and resistance. Instead, offer alternatives. For example, if a resident with dementia insists on taking a solo walk beyond the shelter's grounds, suggest instead a different walk or a walk with others, or provide another option, such as helping out with a scheduled activity. Avoid insisting they do something they don't want to do. No one wants to feel like a child, and people with dementia can tell when they're being treated like one. They won't appreciate it, and they're bound to display their resentment. Instead, find a workaround.
George. Come on, George. It's time to rise and shine.
I don't want to get up.
I know, but everybody's out having breakfast. We'd love to have you.
I don't want to get up. I want to sleep.
Why don't we just sit up a little bit, George? Come on.
I don't want to get up.
I know, but you've got to eat something to keep your strength up.
I don't want to get up.
Okay, all right.
As a workaround example, let's say you need everybody out of bed in the morning, but someone objects and sleeps in. Address this by talking to them. If that doesn't work, you try again in 15 minutes and repeat the process. Remember to approach them with a smile and encouragement. Do not remind them that this is the second, third, or fourth time you've talked to them.
Have you ever folded one of these before? Like this?
Okay.
God, you're so stupid.
Okay, George. Okay.
Stupid.
So show me how to do it.
I showed you.
Okay, George. I'm sorry. I'll.
Avoid taking comments personally. Often a person with dementia will become angry and launch into an outburst about you or something you're doing. They may say hurtful things. As difficult as it may be, you can't take their words personally. Behaviors are the product of the cognitive disability, not the person.
Hey there, George. How are you?
Okay.
Good. I've got 2 shirts. Which one do you like better, the gray or the blue?
Like that one.
Good choice. I think that looks good.
Avoid too many choices. People with dementia have often lost the ability to make reasoned decisions. They may not be able to remember all of the factors or considerations necessary to make a smart choice. Giving too many options is likely to cause confusion and unwanted stress. Keep things simple. If they require help dressing, for example, give them limited options. If the choice involves food, limit the variety on the plate to 1, 2, or 3 choices, no more. It's often best just to serve them a plate with small portions without asking beforehand what they want. If there are objections to the food, you can try to make changes for them, like substituting peas with carrots if available. What is universal and necessary to all shelters are the people who make them work, the professionals and staff who shoulder an enormous responsibility, the care and well-being of people in need. This video showed you the categories, causes, and needs of people with cognitive disabilities, how to make an educated observation, proper registration and intake, and what to do if further assistance is needed, how to help someone with developmental and intellectual disabilities, how to assess and approach people with autism. You learned about memory loss, dementia, and Alzheimer's. This video also emphasized if a situation exceeds your level of training and comfort, you need to seek assistance from the shelter manager or medical services staff at the shelter.
In the event of an actual emergency, you'll need to make the best possible choices and take the most appropriate actions based upon your training, the expertise of professional shelter staff, and common sense. Working in a shelter is a powerful, rewarding experience, and I know you'll do everything you can to make every resident comfortable while supporting his or her independence. Thank you for your time and willingness to serve our community.